Hopefully in the next few months during the Medicare annual enrollment period, we'll be seeing a lot less of this.
Hi, JJ's back because this is important. William Shatner here with a new message about Medicare benefits. I am my father. Extra benefits, extra money. Dynamite! Millions of people have called the Medicare coverage helpline. You should too.
Now, Joe Montana, when you get to be 65, you have limitations for nonsense and efficiency.
The choice is simple.
Hey everyone, this is Rick McDermott here with Senior Solutions Group, and thank you for checking out this video. And if you haven't done so already, please do subscribe to our channel and help share this with other people who need this. So coming up October 15th through December 7th is the annual Medicare election period, which primarily is for people who want to investigate their Medicare Advantage options and Medicare prescription drug plan options. If you're on regular Medicare with a Medicare supplement, or also known as Medigap, you do not have to change your Medicare supplement period during this, your Medicare supplement plan during this period of time. A lot of people get confused by this, so just know that you're going to see a lot of mail and a lot of commercials, but they may be amped down quite a bit this year with some new regulations. CMS, the Center for Medicare and Medicaid Services, has some new rules in force where these telemarketing organizations, these third-party vendors who have been responsible for all the Joe Namath ads and for all the celebrity ads that we're seeing on TV, these come-ons trying to get you to call this 800 number so you can get everything free. We're finally, hopefully, going to see these ads curtailed in a big way. So all this clutter that you're seeing on your TV screen, those of you watching game shows, especially Dr. Phil, you're getting inundated with all this garbage on TV. I would highly advise you to, if you're on Medicare or if you have a loved one on Medicare, to find someone either local or someone that is not part of these third-party 1-800 phone centers, these phone banks, and get your help with someone that you can look eyeball to eyeball or talk to them repeatedly on the phone. So if you work with Joe Smith and he's your agent, you should be able to call Joe Smith and talk to Joe and his staff. You shouldn't have to call some 800 number and talk to some person you don't know who you're talking to. Yesterday, the Kaiser Family Foundation had this workshop with several people. The director of CMS was involved. We had an AHIP official. They are who we take our annual certification through every year to get certified to offer Medicare Advantage plans. We have a lot of clients that have Medicare Advantage. They're happy with their plans. They understand what they're getting in. If you're on Medicare, you have the option of opting out of Medicare and signing up for a private plan. So you're basically handing the keys of your Medicare school bus benefits over to a private insurance company. They take the wheel. Medicare hops off the bus and the bus drives down the road and Medicare is not even on the bus. So if you have a Medicare Advantage plan, you're not on Medicare. You're a part of the Medicare system, but your Medicare card is inactive. It's deactivated. So a lot of people love Medicare Advantage for the extra benefits that they offer, the dental benefits, the vision benefits, the gym memberships, the over-the-counter benefits, but that is not why you should be purchasing a Medicare Advantage plan. You need to look at the big picture. How is your health plan? How is your benefits? How much is it going to cost you if you're in the hospital? If you need treatment? What is your maximum out of pocket? Are all of my doctors in network? Do you understand that if your doctor leaves network, you may have to find a new doctor? There are certain time frames when you can enroll and disenroll from a Medicare Advantage plan. You may not be able to go from a Medicare Advantage plan over to a Medicare supplement plan based on pre-existing health. You need to understand this going in. You can't call these 800 numbers, which have had rapid disenrollment rates. We've seen their stock prices plunge. The complaints have ramped up. We've seen so many complaints that CMS is finally cracking down. Take a look at this segment I'm going to show you from yesterday's workshop.
And the report touches on some of these situations in which people can feel spurred to action out of concern they're missing out on important benefits if they aren't enrolled in a specific plan by calling a specific number and, in the next 10 minutes, or that they're not complying with official Medicare rules or deadlines. And this can be even more difficult to parse when these ads are coupled with Medicare-like imagery, which of course implies that Medicare and not a plan is behind the ad or material. We've had callers say, I don't know what to do about this piece of mail that I just got. It seems like it's from a plan, but it says to respond to the records department by a specific date. Others who are calling to check on things that maybe sound too good to be true, like TV ads saying they may qualify for a discount on Medicare or extra benefits based on their zip code, or because they're hearing something in ads that doesn't align with what they've heard in previous years directly from their plan or from Medicare or from others that they trust, like friends and family. While some people call us before taking action or having their coverage impacted, others don't. Alarmingly, about 20% of our helpline calls on misleading marketing are from people who were enrolled in a plan without their knowledge or consent.
This is Lindsay Copeland with the Medicare Rights Center, by the way.
They were talking to Medicare. Others knew that they were talking to a broker or an agent, but thought that person was just gathering data for other purposes, only to later find themselves with new and unwanted coverage. One recent caller was in his late 80s. He thought he was calling Medicare during follow-up and enrollment, but ended up calling a similar number that connected him with a plan agent who started asking him questions, and thinking that he was talking to Medicare, he answered them. He didn't realize the agent had enrolled him in an MA plan until he got the paperwork several weeks later. And that's a pretty typical occurrence, unfortunately. The last set of marketing-related calls are from people who made intentional coverage decisions, but maybe ones that they regret, and ones that were certainly based on inaccurate or incomplete information from a plan or broker. Many were promised things that failed to materialize. Again, extra benefits, lower Part B premiums, maybe a robust provider network. And it's also not uncommon to hear from beneficiaries who didn't realize what they were giving up, that there were trade-offs involved, like utilization and provider network, and there are extra complications for people who have original Medicare and supplemental coverage like a Medigap, because in some states, Medigap has very restricted purchase rights. And so if you give up your Medigap, you may not be able to get it back, at least in an affordable way. And these coverage decisions can have really surprising outcomes that undermine beneficiary health and financial security, leaving them with higher than expected out-of-pocket costs and problems accessing needed care. One last example here, we had a caller who switched to a new MA plan because she relied on information from the plan's representative, which said that she would save money by doing so. She had end-stage renal disease, and under her original plan, she was paying about $280 a month in coinsurance for her dialysis. And under the new plan, this monthly cost skyrocketed to $1,600. She didn't get those bills, though, until the spring, when it was too late to fix her an open enrollment period, and was just extremely upset and very stressed that she'd be unable to continue to afford her treatment. And often there's no quick or easy fix for beneficiaries who find themselves in some of these situations where their coverage decision has been made on in reliance or inadvertently due to misleading marketing. They may be locked into a plan until the next enrollment window, which could be, the next fall. All of which is to say, I think in summary, that people are confused and they're making decisions that have serious and sometimes really harmful consequences. So we're hopeful that some of these rule changes will begin to make a difference.
So it's very important that when you look at a Medicare Advantage plan and you're talking to a broker or a sales representative, that you get them to focus on the medical benefits. And that might be a challenge because they're going to want to talk to you about all the extras. If they're spending 90% of their talk talking about, well, you get free this, free that, we can give you free wigs, for example. There's a plan that's coming out in our area that has a free wig if you need chemo, which that's kind of nice. But is that the most important thing to have when you're having Medicare Advantage? No, you need to know if your doctor's in network, what are my costs, what is my potential cost. You can't just look in the rearview mirror and say, well, I've been healthy up till now. Because if you're driving along the road and all you're doing is looking in the rearview mirror, you're going to hit something. You've got to be looking forward ahead. You got to be looking, what could happen in the future to my health? Is this plan going to serve me well? Am I going to be able to see the doctors that I want to see or I need to see on this plan? And if the answer is yes, Medicare Advantage can be a great fit. We've got a lot of clients that have Medicare Advantage and they are happy with their plans. When they do change their plan, it's because, well, now I have a new medication. I need to find a plan that's going to cover this medication better. Or I need to see a specialist that is not in network. Maybe I need to switch to a new plan. Well, you can only do that during certain times of the year unless you have special unique situations like you move out of state. You just got to know it's very important not to buy the sizzle, buy the steak. What do I mean by that? So many of these agents, these 800 numbers, are trying to sell the sizzle to get you excited. That's why they show these celebrities, you know, Joe Montana, Joe Namath, all of these celebrities that look like they're happy and enjoying life. There's ads with people bungee jumping, all kinds of stuff to try to lure you into this lifestyle, which is not reality. Most of these ads that promise you money back on your check, that doesn't represent 98% of the plans that are available. You just got to understand these are come-ons trying to get you to lure you in. So if you talk to an agent, get them back on track. What I would do is I would hang up. If they're not talking about the plan benefits, the medical portion of your benefits, 90% of the time, then I wouldn't deal with that broker. They should only be spending maybe 10% of the time on the extra stuff, the extra perks, the extra bells and whistles. 90% of the time should be focused on the health benefits, how it's going to affect you, how it's actually going to play out when the rubber meets the road. Next, we're going to listen to Mark Hamburg from AHIP. That's the organization we use to take our recertification courses every year.
Plans not being permitted to advertise benefits that are not available to beneficiaries in a particular service area. Again, this is important. People should not be signing up for a product that they think has something that it isn't actually being offered. I do want to say, Tricia, that while it is absolutely important that there be a way to look back at potential issues that were raised in the past and make sure that they're being addressed, it's also important to put these issues in a broader context. The bigger picture around the MA program is over 31.5 million people are now in it. More than half of all who are eligible to sign up are now signing up for it. The satisfaction rates are over 90% for MA. People are, by and large, enrolling and staying in these products. So
MA is Medicare Advantage.
Doing so because they and their families are seeing that they provide good value. The program really is working remarkably well for the people who are enrolled in it. If it was not, seniors would not be signing up for it. They would be leaving in droves, or there would be.
Now they are leaving in droves from calling these 800 hotlines. We are seeing rapid disenrollment rates, which raised the alarms a couple years ago. So their stock prices plunged. One of the companies went bankrupt.
Quality metrics indicating inferior care, which there are not. And so none of those facts exist. So I do fear while we legitimately talk about areas of concern, without understanding this broader context, it somehow gets lost and it suggests that there are rampant problems in the program that are, really adversely affecting beneficiaries. And none of the data suggests that.
So wrapping up, why do we never see Medicare supplement ads on TV? You might see them once in a blue moon. Part of the reason is the insurance companies get compensated by the federal government very handsomely. How can they offer a plan for zero premium? Well, they get paid $1,200, $1,300 a month, give or take, from taxpayers for every person they enroll every single month. So the insurance companies do have an incentive to veer toward Medicare Advantage. So you're always going to see more ads geared toward Medicare Advantage. Also, this fall, if you're on regular Medicare and you have a standalone prescription drug plan, you may see your premium double or triple in price. It's very important that you do not throw away your annual notice of change letter, also known as an ANOC letter in our industry. If you're on a standalone Part D drug plan and your rates are going up, and your supplement rates are going up, you might say, maybe I do have to look at Medicare Advantage. I need to save some money here. I can't afford all of this. So we're always available to help you review your prescription drug plan. If you need help with setting up Medicare, if you need help reviewing your Medicare Advantage plan, or if you want to look at Medicare Advantage. Medicare Advantage is a viable program. Over half the people on Medicare are now on Medicare Advantage nationwide. It's not going away. It's got some wonderful benefits, but you need to know the pros and the cons. It's not all here on one side. It's not all here on the other side. It's not all good. It's not all bad. It's somewhere in the middle. It may be a good fit for you. It may not be. If you have any questions, feel free to reach out to us at Senior Solutions Group. We are here for you. Don't get sucked in, folks. You need to advocate for yourself, and we're also here to help advocate for you as well. Take care and have a blessed day.